Families fighting to have overseas grandparents visit their newborn grandchildren say unfair health restrictions are keeping them apart. It's led one couple to take their baby to India to be looked after by her grandmother. And another woman says Immigration New Zealand's decision to reject her mother's visitor visa left her with no support at a traumatic time. Our immigration reporter Gill Bonnett has more.
Rotorua dentist Rupinder Kaur and her husband Pretender Singh, who manages the St John ambulance service in Lakes District, are in India with their 7-week-old baby Rabab. They're returning to New Zealand shortly and leaving her with Mr Singh's mother, Manjeet Kaur Gill. Her parent category resident visa was rejected because she has multiple myeloma. Mr Singh says the retired registered nurse has enough medication to manage her condition, which is in remission and isn't infectious. But they've since also been turned down for a visitor visa.
They run a free clinic at home, back home in India, and she treats patients as well. So she's doing pretty much everything normally.
Mr Singh says they provided medication receipts to prove she wouldn't be using the New Zealand health system. He says as his mother worked for the government, she has all her healthcare costs reimbursed. So it makes no sense that she would try to get medication paid for here instead.
Does that mean that she cannot even visit her family ever again? Because once you've got the condition, you've got the condition.
He says as he works 12-hour shifts at St John, the couple hasn't been able to get a nanny to cover times they were both at work when his wife returns to her dental practice next month. They hope Rabab and her grandmother will now come to New Zealand in the winter, but no, there is no certainty about that. Visitors applying for temporary visas don't routinely have medical tests, but their results remain on immigration files if they've had abnormal results when they apply for other types of visa. Tanya Sabnani ran into the same problem. She says she planned to get her mother a grandparent visa, but an ECG showed up an abnormal result. After having an angioplasty procedure, her mother was given the all clear to travel, but was again rejected, this time for a visitor visa. Ms Sabnani says she went into deep depression after the birth of her son Yuan in November, who was then admitted to hospital for 10 days after Christmas with Kawasaki disease.
Not having any whanau here just literally broke us. It was supposed to be the most exciting time of our lives, but it's just been so stressful.
Ms Sabnani, who works at a fertility clinic as a geneticist, says they've provided financial sponsorship and her parents have medical insurance. She's now considering taking a long holiday to India with Yuan.
I don't really want to go because that means that my baby is away from the daddy for a little bit and dad can't take a lot of leave. And when you consider New Zealand as home, you just feel, is it really my home where my parents can't come and visit me?
Immigration New Zealand says all visitors must have an acceptable standard of health, and their ability to pay for medical services or medication has no bearing on whether they're likely to impose significant costs on the public health service. For Checkpoint, Gill Bonnett.